Good afternoon, and thank you for joining us today for our virtual event for National Nursing Week. My name is Deanna Garand, and I'm a student in the Faculty of Science. I'm also part of the Red River Métis Nation here on Treaty 1 territory, and I will be your Master of Ceremonies this afternoon. Today's virtual event will officially launch a mental health promotion project connecting one conversation at a time, led by College of Nursing faculty, Dr. E. Mordock, Ms. Shelly Marchenko, and Ms. Pat Pruden. We will hear from the Dean of the College of Nursing, as well as the project's student office assistant. We also have two guest speakers joining us today, as well as a nursing student panel, along with games and prizes throughout the event. While stories and perspectives are shared today, some content and topics may be triggering for some attendees. We want to bring your attention to the chat, where a link can be found to connect with mental health resources and crisis lines throughout the event. We will also host a debrief session following the conclusion of our event today. If you wish to join us for this debrief session, please stay on the Zoom call, or you can rejoin at the end of our event today. The University of Manitoba campuses are located on the lands of Anishinaabeg, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in spirit of reconciliation and collaboration. I would now like to call upon Dr. Neetha Dick, Dean of the College of Nursing, who has graciously helped fund this project through the College of Nursing.
Good afternoon, everyone. As the Dean of the College of Nursing at the University of Manitoba, I am delighted to welcome you to the official launch of a very unique and inspiring initiative focused on connecting one conversation at a time. Thank you for coming to help us launch this critical initiative and assisting us in increasing awareness about the importance of connecting with one another and accessing mental health and wellness resources when needed. I commend the stellar team who conceived this innovative idea for this project. The team provided the leadership in obtaining approval and funding for the project and exercised perseverance in seeing the project through to completion, given the challenges of the pandemic. This innovative team is comprised of Dr. Elaine Mordock, adjunct professor in the College of Nursing, and instructors Shelly Marchenko and Pat Pruden. I would also like to recognize our student leaders from the Nursing Students Association who have been actively engaged in this initiative, including Jillian Lanenga, Francis Hernandez, Winter Traverse, Maria Padrello, and Zoe Hedlovit. Given the team's knowledge of the need for mental health services among students and their concern about the research findings related to anxiety among students, they felt compelled to take action. Research conducted with university students revealed that nearly 2/3 of students felt overwhelming anxiety, while nearly half reported feeling so depressed that they had difficulty coping. Furthermore, accessing counseling services could be difficult for students due to a lack of knowledge about mental health services, lack of timely access, stigma, and cultural perceptions around mental health and mental illness. This team's remarkable work has resulted in the establishment of this important initiative, in which 2 benches installed at the University of Manitoba will offer a comfortable place to speak to a friend or colleague, to meet new people, or to look up information about mental health and wellness through the strategically placed QR code and website links. Resources offered via the QR code offer a safe way for students and others in need to reach out without having to do so face-to-face. The QR code connects students with a range of mental health resources related to suicide prevention and other important mental health issues. As such, this initiative helps foster a healthy and caring community and creates an environment that builds awareness of mental health and its important relationship with academic and workplace success. The University of Manitoba's strong commitment to health and wellness is evidenced by establishing the Success Through Wellness grant. I would like to thank the university for recognizing the need for this initiative and the significance of its positive impact. We were delighted to receive approval of this team's grant application, which provided the funding for the project. The College of Nursing was pleased to contribute additional funding and in-kind supports to ensure implementation of the initiative. Now that we're back on campus and hopefully enjoying some warm summer weather, we look forward to using the bench that is located outside of the main entrance of the Helen Glass Centre for Nursing, and the bench that will be installed at University Centre in support of mental health and wellness of our students and colleagues. It is very timely and impactful to launch this initiative in conjunction with the celebration of National Nursing Week. The theme of this year's Nursing Week is "We Answer the Call." This initiative is a remarkable example of how nursing faculty and students answered the call. Our team of faculty identified a significant issue. They developed a plan to address the issue and ensured the plan was implemented. They took action and answered the call. Over the past 2 years of living through the pandemic, many people, including our students, have experienced prolonged isolation and lack of connection with others. We've learned and experienced the importance of connecting with others, along with the need for empathy and compassion. We look forward to the impact of this project and trust that it will result in many conversations about mental health and that it will lead to greater access to the excellent resources and services available and result in an increase in mental health wellness. So thanks again for coming to launch Connecting One Conversation at a Time and doing your part in raising awareness of the resources available to students and others in need of mental health supports. Thank you.
Thank you, Miigwech, Dr. Dick. I would now like to call upon fourth-year nursing student and Connecting One Conversation at a Time's student office assistant, Zoe Hedlovit.
Hey everyone, I'm Zoe. I just finished my third year in nursing. So I'm the student office assistant for Connecting One Conversation at a Time. And I just want to go over the project a little bit and a little bit about my role. So first, a little more information about the project. It launched in fall 2021. It's funded by the College of Nursing, Rady Faculty of Health Sciences, and Success Through Wellness here at the U of M. So the goal of this project is to facilitate connection between people and provide resources for students, staff, and visitors who may not feel comfortable reaching out face-to-face. And we hope that the visibility of the benches will support and encourage conversations surrounding mental health and help people feel less alone when they're struggling. The benches will also serve as a reminder of the importance of mental health and connecting with others. So these benches have QR codes, or they will have QR codes, that lead to mental health resources in Manitoba, on and off campus, as well as relaxing playlists and games or apps that are related to mental health. So this allows people to access the resources they need without having to do so face-to-face, which is a common barrier for people in our community. And also, even if people don't use the resources from the QR code, they can still scan them and refer a friend or a family member to them. We just wanted to say a few thank yous for helping kickstart this project. So first of all, Dr. Neetha Dick, the Dean of the College of Nursing here at the U of M. Dr. Dick has provided funding for this project, and she recognizes how important mental health is, and her support for this project made it possible. Next, we want to thank Arlana Vadney from Success Through Wellness for her ongoing support. And then I also want to thank some faculty advisors, so Dr. Elaine Mordock, Shelly Marchenko, and Pat Pruden. Pat is unable to be here right now. I think she's joining a little bit later, but they have launched this project and advised me in my role. So I wanted to thank him for that. And then a little about my role as the student office assistant. So my work centers around mental health and wellness on campus and promoting well-being. So a large part of my role is creating content for the College of Nursing Instagram, which I will show some examples of in a few slides, and I'll go over some of the posts. I also created the logo, the QR codes, and set up the link tree that I just posted in the chat a little bit ago, where the resources can be accessed. I also work with other staff and students like NSA students, so the Nursing Student Association, and some of these students will be speaking on the panel later today. So here's the QR code. You can scan this on your phone quickly if you'd like, but I will just go over quickly what is on it. So this will be what shows up on the bench here. And so the first link is some mental health resources. A lot of them are crisis-based, just in case people happen upon the bench and want to, need serious, help, and just other resources like that. And then the next link about the project, just some information here. And then it also connects to the Instagram, which I'll go over in a little bit. And then you can click this icon to go to Spotify, and it will give you some like calming playlists. Sometimes people just want to listen to music and things like that. And then these are some apps that Shelly will go over in a little bit. And just here are some examples of the Instagram posts that I've created. And I've also consulted with other nursing students and other students in general to get a perspective from them. I will go over that now. So first, I just want to thank Winter Travers for her input and leadership on this post here, and recognize the importance of the Indigenous nursing student perspective. So just going over some posts about the importance of how different identities intersect and have a role to play in mental health. There's also this post about Black History Month in nursing, where you can learn about some of the history behind it. And then there's general resources for students to use, things like that. And then lastly, I just want to note that this initiative has won a sustainability award this year for our efforts to promote mental health and well-being on campus. So the plaque located here in the top left was awarded to the NSA. And I'd like to thank some of the members in particular. So the outgoing senior stick, Jillian Laniga, Indigenous Student Representative, Winter Travers, Francis Hernandez, and Maria Danielle Pajarito.
Thank you, Zoe. I would now like to call upon our first guest speaker, Louisa Aquino, an award-winning mental health activist and graduate of the University of Toronto with a Bachelor of Science in Psychology and Health Sciences with a double major in International Development and Mental Health. She received the YMCA GTA Peace Medal Award for a nonprofit Peace of Mind project that provided youth across Canada a safe space to talk about mental health. Louisa led a virtual national mental wellness workshop with Student Life Network in partnership with CIBC for over 500 students. She is identified as one of the top 10 most influential Filipinos in the diaspora. Welcome, Louisa.
Thank you so much for that amazing intro, and I'm so excited to be here. Thank you again, Elaine, for inviting me to be a part of this super special project. My name is Louisa Aquino. I am a 22-year-old mental health advocate, and I'm a first-generation immigrant from the Philippines. Since the age of 15, mental health has been something that is super close to my heart, and I pursued my passion through post-secondary education. As a young person, an immigrant, a person of color, and as a woman, being underestimated, overlooked, and not being taken seriously is not a foreign concept to me. And there have been many challenging moments in my activism journey that were filled with discouragement, defeat, negativity, and self-doubt. But the most trying phrase that I've heard throughout my entire journey consisted of 5 simple words. That's just the way things are. It came from the mouth of an executive on my school board when I was 15 years old. We were meeting to talk about promoting mental wellness among students across the district exactly 6 weeks before I lost one of my best friends to suicide. He told me that people having poor mental health and the stigma around it will never change, because that's just the way things are. That was 7 years ago, and unfortunately, at the time, I believed him. I believed that taking care of your mental wellness was overrated, and that taking care of your mental health should not and was not a priority. I felt like I had to be doing well 24/7, and if I took care of my mental health, it was because I was weak. I felt like I had to choose between my own mental wellness or being a good student or a friend or a sister or a daughter. I felt like I had to choose between prioritizing my own mental health and being an advocate for positive social change. I don't have much time to speak with you all today, but I think it's important to use these few moments to remind everyone of the power and importance of putting yourself first. You all play important roles in your lives, your friends, your family members, and a lot of you, of course, are soon to be nurses. You all have people you love and patients that you care for. And I want you to take a few seconds to think about the people that you would go to the ends of the earth for, just to know that they are safe, healthy, and happy. Did anybody put themselves on this list? Because oftentimes we unconsciously or sometimes consciously neglect ourselves as an individual who needs care. But we don't think twice before we use every fiber in our being to convince someone we love that they are enough and that they need to take care of themselves. But do you share that same amount of effort and passion, charisma, and unconditional love towards yourself? I was speaking to a friend who coincidentally is also part of the nursing program at U of M. We were discussing the fact that a nurse's entire job is to literally take care of other people. From the second you enter the program, everything you do is to ensure that you can help every single patient you will come across in the future to the best of your ability. With that being said, it can be very easy to lose sight of the importance of taking care of yourself first. And I know it can be easy to forget to take care of yourself in an industry that serves people. I've learned many lessons the hard way. And as a young person, I hope that someone can resonate and take at least one piece of advice that can help make their journey of self-care a little bit easier. So the first thing I learned, a power of putting yourself first is that you get to become a leader. We are told all the time to take care of ourselves, and sometimes we feel guilty or selfish in doing so, or we're simply too busy. But what we sometimes fail to understand is that when you learn to put yourself first and take care of yourself mentally and physically, you're not only able to better help yourself, but also those around you. You can lead by example and remind others that taking care of mental wellness is not selfish, but it's necessary. You can serve as living, breathing proof that prioritizing yourself and your mental wellness is the first step to becoming a leader. Another thing I learned is that a power of putting yourself first is longevity. At some point, many of us have taken on much more than we can handle. It means we have burned out while we are caught up in trying to make the world a better place or for caring for those around us. But when you put yourself first, it serves as an opportunity to reflect on your mental wellness and remind ourselves that our brain needs some love too. It may take some time to figure out what works best for you in order to fulfill your self-care and mental wellness needs. But you will make it so much further down the road and you will thank yourself for it later, and so will the people around you. Another power of putting yourself first is that you allow yourself an opportunity to grow and experience new things. Sometimes a person, a place, a thing, a habit, or a routine that used to contribute to your mental wellness ends up doing more harm than good. So it's okay not to always be okay because life happens, but don't stay discouraged. At one point, we need to get up and do something about it. You need to put yourself first. We need to normalize change because taking care of your mental health is not a linear path. And we need to remind ourselves that it's okay to let go of things negatively affect our mental health, whether it's a bad habit, a friendship, or an outdated self-care routine. And the last thing I learned is that a power of putting yourself first is that you begin to hold yourself accountable because you start to realize that you deserve better. When we acknowledge that we deserve better, we take control of what we can, including how we handle adversity and how often we give ourselves the love that we deserve. We are better able to empower ourselves and other people in our lives to hold themselves accountable to prioritize mental wellness. I think we all know that nothing comes easy, but I hope that we all also know that it will all be okay. We find comfort in knowing that we are never alone in anything that we face. Reaching out, getting help, putting yourself first, and talking about mental wellness does not make you weak. It makes you strong. I hope you take time today to reflect on ways that you will prioritize your mental wellness, even in our very busy lives, because the world needs you to be as strong and as healthy as you can possibly be. I believe that we all have access to one of the most powerful tools in the world, our voices. I've always been an advocate for the power of conversation because I've seen it make transformational changes in people's days and even lives. I'm a person who lives with anxiety and depression and post-traumatic stress disorder, and a simple conversation with somebody who can relate to my experiences has gone a long way. So the title of the project that brought us all together today, One Conversation at a Time, is so fitting because I truly believe that it's the first step to positive changes. The stigma surrounding mental health and the silence it entails may be loud, but I know that together our voices are much louder and much more powerful. I hope that you have conversations with the people you love because nobody is immune to struggling with their mental health. I know it is a touchy subject, but it does not mean that you should not touch it. And trust me when I say that you might regret not having the conversation or not taking it seriously because mental health is real, and I wish that's something that I learned earlier on in life. It lives in all of us, even if we are not diagnosed with a mental illness. I'm a large believer in the fact that you don't have to change the whole world, but you can change one person's world and make all the difference. I want to encourage you all to talk and, just as importantly, listen and learn, because conversation leads to education, and education leads to awareness, and awareness leads to a more empathetic approach to mental health. I want to encourage you to check with one friend in the nursing program and one friend or family member outside of the program. Take time to learn about the struggles and obstacles that other people have gone through. Share your stories and perspectives, because we all have lives worth living. We all come from different walks of life, but all of our stories have value and they all have worth. But also remember, you are not a mental health professional either, but listening itself can go a very long way. My acknowledgement for the power of conversation came to me when I realized that slowly but surely, with one word at a time, one story at a time, and one voice at a time, we could all show others that they are not alone. Our unique stories and voices brought us all together today. And leaving here today, I want to challenge you to make a healthy change that supports your mental health, whether that's your daily life or the communities you are a part of. And I challenge you to remember to never accept that that's just the way that things are. This project is amazing and it means a lot to me since I'm from Manitoba, grew up in Winnipeg, and a lot of people who are close to me attended the university and have gone through the nursing program. I know that even being in a room here with future nurses and just knowing that everyone is passionate about mental health, who is able to kind of take care of themselves and kind of realize that at the end of the day, as a nurse, I believe that it's really important to be able to take care of yourself because we rely on you and everyone else relies on you. And we've seen that throughout the pandemic, that mental health of nurses and healthcare workers and frontline workers should be at the utmost priority for themselves because they do make a big difference. They do make an impact in our lives. I also want to say thank you so much to everyone a part of the team for hosting this amazing event, for launching the project. It was truly an honor to be a part of today. And I think we do have a few moments for any questions, if there are any.
Thank you for your talk. It was excellent and just really stressing the importance of mental health. But I believe you're still living in Toronto, is that?
Yeah, so I actually go between both. My family's in Winnipeg and I'm here, but I'm almost there, like basically a week every month.
And you went to U of M too at one point? Or
no, both of my siblings do. So my brother's actually in the pharmacy program and my sister graduated from Asper.
So I was just wondering maybe if you had any perception of if there's a difference in mental health resources overall in Winnipeg compared to, I guess, more so in Toronto.
Yeah, so I would say that there are a lot more resources in Toronto, but also the saturation, because there's so many people, kind of balances out quite a bit. I find that it's a lot easier to access mental health resources in Winnipeg just because it's a smaller population. But something that I've turned to a lot over the past year are actually virtual apps. So through work, I was offered something called Dialogue, where you can talk to a mental health specialist. During a time of crisis last year, I actually accessed something called Maple. And Maple allows for people to book an appointment within 24 hours with a mental health specialist and professional. So that has been super helpful. I know that there's other apps called BetterHelp, and I just find that especially over COVID, the resources have kind of expanded in terms of accessibility, especially because of that restriction of being able to go in person. And in Toronto, I was actually not able to secure an appointment with a psychiatrist, but I was able to in Winnipeg. So it's definitely a bit more difficult in that sense. And also as a graduate from U of T, there were about 90,000 students and 90 counselors and therapists that we had. So that ratio is 1 to 10,000, which is not that great. So it's definitely a bit harder as a past University of Toronto student. But I would say that even projects like these can make a huge difference, because sometimes you don't need necessarily professional, you just need a friend, or you just need a conversation. And I think that's just something I've always loved about mental health and its advocacy, is that we can make a difference on our own, and it's not necessarily something that you need to give up an arm and a leg for.
Thank you for sharing that.
Awesome. Thank you for that question. Are there any more before I pass it back on to, I think, Zoe?
Louisa, what do you think now of the school person? I think you said it was a principal that had the attitude of this is how it is. You can't do anything about that. When you reflect on that, what do you think?
I mean, like, as a young person, I was 15, and I obviously believed a lot of the things that teachers and board executives had told me. And I just look back and I just wish that, there was a lot more words of encouragement than words of doubt. I think he was trying to be realistic, but I also think that he wasn't optimistic. I think there's a balance between realism and optimism that just wasn't there. But I also would not change it, because that definitely did push me to try and prove him wrong. Which I hope I did. So as much as it did hurt in that moment, I definitely look back and I'm grateful, because moments of adversity and challenges like those really did push me.
Thanks for sharing that reflection. You seem very wise for such a young person.
I feel like I'm like 80. I think I've lived a full life by the time I'm like 21. So I think I'm done. I'm done now. I'm going to retire.
Thank you, Louisa. I would now like to call upon Dr. Elaine Mordoff to moderate our student panel today.
My pleasure right now is to moderate the student panel. And we really should have called it Stories from the Bench and linked in our benches, but just thought of that now. Anyway, this is really student stories and perspectives on the broad issue of mental health and mental illness, I suppose. We left it really quite open. So first, I want to sincerely thank the students who are going to share some of their perspectives with us. I know it's always busy when you're a student, and particularly around this time, you just finished exams and clinical, and there's been disruptions and things, and you've had to make adjustments. So we really appreciate you coming to do this work with us. So the students that we're going to hear from are Jillian Laguina, Gary Regis, Anne-Marie Kaithler, and we know Zoe now. Zoe's going to be the final speaker here. So the students will talk for about 5 minutes, and then we'll move on to the next student, and then we will open it up for comments and questions after Zoe's finished. So welcome, students, and thank you. And we'll start with Jillian, please. Jillian's a senior stick.
Hi, everyone. Thank you, Elaine. So for those who don't know me, my name is Jillian. I'm a fourth-year nursing student, and I'm the outgoing senior stick for the Nursing Students Association. I think mental health is an extremely important topic to be aware and educated on as nursing students. I'm a firm believer that being educated on mental health, as well as how to support someone who is struggling with their mental health, is applicable to any area of nursing, not just the field of mental health. I've personally experienced this in past clinical rotations, such as medicine and surgery. While it is important to be educated on different mental illnesses and how to support patients who may be struggling from a mental illness, it is also important for us to be aware of how mental illness can affect the patient's overall health and recovery. One example being how anxiety can often increase one's pain perception. Hence, I think it is invaluable as future nurses to be able to care for patients who struggle with their mental health with a non-judgmental and patient-centered approach. Lastly, I think it's very important to emphasize the importance of taking care of our own mental health as nursing students, because it can be very difficult to care for others when you are struggling yourself. I've learned to become more open to discussing my own mental health during school with my peers, and often they will also open up to me about similar struggles. I think that learning to become more comfortable talking about mental health and being honest and open with one another helps to break the stigma about mental health and helps us to feel less alone when going through these difficulties. In addition to having these discussions with one another, I've also been a strong supporter of taking time to do things you enjoy while you're in nursing school. When we enter this ever-challenging program, we are frequently told that we will not have time to work, nor have many hobbies outside of nursing school. However, I strongly believe that every student can find time every week to do something they enjoy. Of course, every person is different in their ability to manage their time, as well as what other commitments they have. So the amount of time each student will be able to set aside varies. With this being said, I encourage nursing students and students from any faculty for that matter to continue at least one of your hobbies throughout the school year, whether that be playing a sport, baking, watching Netflix, reading, going to the gym, or any of the other suggestions that were in our bingo game or anything else that people enjoy doing. With all this being said, I know sometimes students feel like they can't partake in their hobbies as they feel that they're taking away from their study time. While this sometimes may be true, and I've felt the same way in the past, I have found that after taking time away from studying to go play hockey or go to the gym, I often return to my studying with a fresh mind. And I also often find myself finally being able to figure out a tricky concept after giving my brain a much needed break. Further, I find that incorporating your hobbies into your weekly routine is very important to prevent feelings of burnout and exacerbations of mental illnesses. I've experienced this firsthand as during the 2020 to 2021 school year, my hockey season was canceled due to COVID, of course, and I was also laid off from my job. While this provided me with much more time to study and complete schoolwork than I'm used to, I still found myself feeling much more burnt out and feeling not like myself as compared to other school years where I play hockey and I also go to work outside of my time doing schoolwork. So again, I emphasize how important I think it is to continue doing the hobbies you enjoy while you're in school, because despite it making you feel a lot more busy than usual, it is often the much needed break that your mind needs and helps to uphold your mental well-being while in university. Thank you, and I'll hand things back over to Elaine.
Yeah. Thank you, Jillian. Now we're going to move on to Garry for his perspective.
Hello, can you guys hear me?
Yes.
Awesome. So yeah, I just like to introduce myself. My name is Garry Regis. I just finished my senior practicum in mental health at McEwen at St. Boniface at units M2 and M3. First thing I'd like to do is extend a big thank you to Laurie Supram, who was my faculty advisor for my senior practicum, and a really big thank you to Shelly Marchenko, who was my professor for my mental health class. She was one of the big reasons why I decided to pursue mental health in the first place for my senior practicum. And she also taught me one of the most important things I could have learned from mental health, which was that there's no health without mental health. And I try to kind of use that for all the patients that I'm assigned and for all the care as kind of like a base on how like I approach the care. Funnily enough, I didn't actually get to do a mental health rotation for year 4, semester 1, I think it was. So like I was kind of naive and I didn't know what to expect going in. I was a little bit worried, like, will I lose my skills? Will I even get to use some of my skills? Which is something I know a lot of students who are considering mental health kind of are thinking about it or worried about. But yes, there's not as many skills that we get to do, but it really gives us the opportunity to kind of like work on our communication skills and like and connecting with patients. So like the bedside manner kind of thing. We still get to do some skills, don't get me wrong. Like we still do the injections for like long acting antipsychotics, or I did a lot of dressing changes, which I was a little bit surprised about. Probably did like 3 or 4 a week, which was something I didn't expect. I used sterile technique and everything. I passed the demos, I'm okay. Yeah. So what I've noticed is that the patients on my unit or on the units that I was working on, they're a little bit more susceptible or vulnerable to some physiological health issues due in part to the mental health challenges that they're facing, right? So this kind of like really connects back to, again, there's no health without mental health, right? And kind of as I mentioned earlier, I didn't get to do my mental health rotation for year 4. So there was a lot of things that I was surprised about going in, but definitely the most jarring like experience or like thing that I've noted is just like the intersection between like the patient population and the social determinants of health, which I know we learn every year, but that's such an important concept that I've really seen firsthand during my senior practicum. Many of the patients on the units I worked at are faced with other barriers, such as like housing instability. All of them are low income, and there's many Indigenous patients as well, which could be in part due to like intergenerational trauma, which we've learned in classes, right? And it's important we address these like social determinants of health too, because for Indigenous patients, it's not only a way for us to take steps towards reconciliation, but also like the simple act of acknowledging like these determinants of health allows us to take steps towards addressing the root causes. So use that root cause analysis thing that we've been learning, why. So we can start advocating for social justice and providing supports for the housing, income, community and social supports, but also especially, which is the big one, is cultural supports, which I think have some ways to go, especially in the medical field, because we're quite a bit focused on the medical aspect, but we're getting there. And I'd also like to add, like, I'm still growing. I just finished my senior practicum, so it's kind of like I'm kind of like a fledgling nurse. I haven't written my NCLEX yet. Wish me luck. I hope I do well. So I'm still growing and learning. Obviously, I'm nowhere near the expert in this field that I'd like to be. I will continue seeking out learning opportunities, not only to further my own knowledge of medicine, but also in advocating for mental health supports and resources, because as we know, there's no mental health, or there's no health without mental health. Thank you. That is my part.
Thank you, Garry, for all those insights. And I think everybody in the nursing faculty is going to be happy how you weaved that all in, that actually things you learned did come into play when you were out there in your practicum. And I really like the connections that you made there.
Yeah,
particularly, sorry, go ahead.
Yeah, 100%. When I was taking those classes, I didn't see that. But once I started actually working and seeing it on a day-to-day basis, it was actually quite like prominent in my day-to-day.
Yes, so. Yeah. And I also like the fact that you zoomed in that sometimes people with mental health problems and diagnoses, they are more susceptible to physical illness, which probably ties in again to the social determinants of health. But it's good to keep that in mind, because sometimes you only see the mental health lens. So thanks for that. Two very different conversations, and they're both so good. Okay, so now we're going to move on to Anne-Marie and hear what her thoughts are.
Hi. Garry, first of all, I'm in your same boat. Good luck. I know you're going to kill it on the NCLEX. My name is Anne-Marie Caitler, and I'm a nursing student at the U of M. I just recently completed my senior practicum about a week ago. And I was placed on PX3, the forensic unit at HSC Psych Health. And I chose to do my senior practicum in psych because mental health is very close to my heart. I wanted to become a nurse so I could help people. And ever since dipping my toes into the pool of intersectional feminist literature and social justice issues, I began to realize that the people I'm drawn to helping are those a little more on the fringes of society, and the ones we don't really want to talk about. I think we're all familiar with the idea that mental illness has quite a stigma attached to it, no matter how much Bell Let's Talk may hashtag for mental health awareness. Nursing school is hard. Demos are hard and stressful. Just being a human being is hard and stressful. I've had and continue to have my own struggles with mental illness, something I'm pretty open about. And this is openness, I believe, that has allowed me to deal with it in a healthier way, and has allowed me to have a certain level of empathy and compassion in this field of nursing. Opening up that conversation about struggle, doubt, pain, shame, this is all what connects us as human beings. Interestingly enough, though, I've noticed that it seems that working in psych health has somewhat of its own stigma in the world of nursing. Even throughout nursing school, working in psych seemed to have the reputation of you're just sitting around and not doing anything. When compared to the seemingly superior conventional image of nursing that I grew up believing, working in emergency, urgent care, med surge, labor and delivery. In contrast, psych felt as though it was painted with the lazy brush. And I've struggled, just like Garry said, with my own fears around the subject, like, ooh, I'm going to lose my skills. And I did use some skills. Even when people ask, like, I see the excitement when I tell them I'm going to be an RN, and they ask, ooh, where? And the silence and awkwardness that I'm met with when I say that I'm going to be working in psych. It's like people don't quite know what to say and they feel uncomfortable. Imagine if I came right out and said that I dream to work at a harm reduction clinic or with sex workers. But it's exactly this discomfort and lack of sparkling conversation that the topic of mental illness provokes that raises great big flashing signal in my mind telling me that I'm headed in the exact direction that I need to be. It ignites a fire within me that I can't quite explain. Nursing in the psychiatric field is a different set of skills, and that's okay. The brain is a wildly complex organ, and mental disorders need to be treated carefully and uniquely with a combination of medications, therapeutic communication, cognitive interventions. You wouldn't tell someone with like hepatic encephalopathy, like, have you tried just having a more positive attitude about it? We would never say that. So why would we say that to someone suffering a major depressive episode? It's something I'm very passionate about. And lastly, I love the quote, do not ask what the world needs, ask what makes you come alive, because what the world needs is people who have come alive. And working in mental health makes me come alive.
Anne-Marie, thank you for your passion. It's beautiful to hear. And we have some nursing role models out there that hopefully you will connect with to help you feel kind of embraced by mental health nursing. But thank you. And thank you for your genuine feelings about it and being able to reflect those. Okay, we'll move on now to Zoe, please, who will be the last speaker about student stories and perspectives.
Hi, everyone. I'm sure you're sick of me by now, but I want to thank everyone for, everyone's saying such great things. It's hard to follow. So I became interested in mental health in high school, and I witnessed a lot of things that people were saying, social determinants of health, my friends, myself, I struggled with mental illness, mental health, things like that. And then in university, I struggled, like many others, to adjust to the demands of university, making new friends because I'm from the States. So that brought additional challenges. So like being in a new environment, well, even it's not that different, but you know, making new friends, not knowing what's available, and being on my own, you know, it's intimidating. And a lot of people here go through that same thing and from even further places than, you know, 7 hours away like me. And in my second year, I actually joined Healthy U, which is a program here, and someone will be talking about that a little bit later. It's just, I was volunteering for it and promoting health and wellness on campus, and it really enforced my want to help people. So I decided to apply to the nursing program. And as I've gone through the program, I've noticed, like the other people have been saying here, I just finished third year, so I've only done med surge and subacute. But I think mental health ties in just as much as physical health. Just like Garry was saying, there's no health without mental health. I've had experiences like counseling patients or having patients with a history of mental illness, things like that, in med surge units. So I think all nurses should be comfortable having these conversations, not just psychiatric nurses, not just mental health nurses, because it can happen at any time. So I think that having these conversations like we are today, and emphasizing the importance of psychiatric nursing and nursing with the psychiatric mind frame even, is just really important. And I want us to be able to support patients with anything that might come their way. I've also noticed how COVID has impacted people with patients that I've taken care of. There was a while where no one was allowed to have visitors, and they were feeling alone, burnt out, isolated, and it like affected their healing physically because of the emotions they were having. And also as a nursing student, like Louisa was saying, we need to take care of our mental health as well. And COVID has affected so many of us, myself, my classmates. So many of us have felt burnt out, isolated. We've had missed clinicals, we've had virtual schooling, and it's jarring. But I think, like what Louisa was saying, is just taking care of ourselves so we can take care of other people is really important. And that's a lot of what I've learned throughout nursing so far. So yeah, I think that's mainly what I have to say for now. I'll pass it back to Elaine.
Well, I want to genuinely thank all of you for your perceptions that ranged really from personal, tying in with the self-care issues, and then looked at how you can use these in nursing and the importance of being able to feel comfortable to talk to people about sensitive issues and recognize that is part of the nursing role. So you all gave us a gift from your perspective. So I thank you for that, genuinely. I'm wondering, I think we have time for one or two questions here, one at least. Is there someone who would like to offer a comment or a question?
This isn't really a question, but just would like to commend all of you for your talk on what you shared about mental health. And it makes me feel really good too, because, you know, in teaching mental health, taught for years and years, and just in hearing what you have to say, I think, you know, some messages are, you're taking away some messages from class, and but, you know, also bringing in your own experiences too, of course. And I know that Jillian and Zoe, you've finished your terms, and, you know, that's been a hard slog through each of those terms. So congratulations on that, but also congratulations, Garry and Rady, for finishing your practicum, and soon we'll be working nurses.
I wanted to say again, thank you to the nursing students who spoke on the panel and to Elaine for moderating. Now I would like to call upon Brianna Barker, registered psychiatric nurse and health and wellness educator for the University of Manitoba. Brianna has worked in inpatient psychiatry and community mental health in Winnipeg and the Interlake, and is passionate about mental health topics.
Thank you, Deanna. I'm just pulling up here. So hi, everyone. My name is Brianna Barker. I graduated from Brandon University with a degree in psychiatric nursing, and I am currently working as a health and wellness educator here at the university. I just wanted to give a special thank you first to Zoe and Elaine and the rest of the hosts for inviting me to join today's presentation. It has been wonderful so far. So for the next 10 minutes or so, I have the opportunity to speak a little bit on my experience as a psychiatric nurse. I've been asked to talk a little bit about my interest in mental health and a little bit about what we're doing here now on campus within the health and wellness field. So like the end of this, if I don't ramble on too much, there'll be some time for questions as well. So I wanted to start by saying how refreshing it has been to listen to the UM nursing students here, the four of you, speaking about how important mental health is for you and how meaningful your mental health work has been. I agree. I think that working in mental health, bias, but allows you to connect with others on such a vulnerable and deeper level, which I think is a very special opportunity that not a lot of other jobs are going to be able to give you. I'll just speak a little bit too that I have had the same fear that I'm going to lose certain skills depending which job I'm in. And I've noticed over the last 4 years that in the end, you learn the skills and you keep the skills that you need to use to help your population survive and flourish, whatever that skill set may be. Okay, so sorry, that was a little impromptu blurb there because I was quite inspired by hearing all of your stories, but we'll get into it now. So my experience as a psychiatric nurse has been quite robust in terms of place settings and area of mental health. So once I graduated, I immediately started working in inpatient settings. So this included hospital psychiatric units and crisis stabilization units. So things like PX3, the St. Boniface inpatient unit, and the crisis stabilization unit in Winnipeg and the Interlake. In the area of mental health, I focused on mostly in my career when I first started, I would say would be acute and crisis. So stabilizing individuals so they could resume their lives back in their home environment and communities. From the inpatient setting, I moved into community work. Again, a little worried I would lose certain skills, but quickly learned I was going to learn new skills, working as an intake and triage specialist for the community mental health program, as well as a community mental health worker. So I've done community mental health work for both adults, children, and adolescents. Although there were certainly crisis situations that presented, the majority of work here was working with individuals with severe and persistent mental illness, so trying to help them flourish in their communities and environments and maintain that stabilization to avoid the crisis, or hopefully try to avoid a lengthy hospital admission. So this sort of looked like combining a nursing work and social work role, which was really special, but it looked like finding stable housing, helping these individuals secure funds with jobs or getting a bank account set up, ensuring access to food and shelter, really going back to the foundation of basic needs. And like some people were talking about the determinants of health, they really do always come back. Providing education on mental illnesses and treatment options, because a lot of individuals aren't aware of what their treatment options are or what it means to have a diagnosis of schizophrenia and how that relates to maybe alcohol or cannabis use when their friend who maybe doesn't have the same diagnosis is using a little bit differently. And as well as a really large focus on connection. So connections to family, to friends, to peers, and to community resources. One of the biggest parts of my role while working in this job in this case management job was to create and revise recovery plans. So one of the most valued important sections of this plan was on relationships and connections. So who does this person have in their life to support them? We could look at friends, family, it could be a healthcare provider, a peer, a support group. It was really important to both help the individual acknowledge the connections as well they had, as well as to help them build the connections if they were having trouble. We're human and it's really hard to do things alone. So just really remembering to acknowledge connections is a really big part of nursing. So that's a quick history of where I've been, and where I am now is, like I mentioned, the health and wellness educator role here at the U of M. So I'll talk a little bit about what we do here. I focus primarily on providing health and wellness education and guidance to students, staff, and faculty. So this information can be on mental health, which a lot of it is, physical health, substance use, relationships, sexual health, and overall social and cultural well-being. So the point of my role is to provide the most up-to-date knowledge, so whether that's factual treatments, interventions, coping skills that individuals can use to make their own health-related choices. So I do this through a variety of platforms here, and I do this alongside of the Health and Wellness Program Assistant and the Healthy You program, which I can talk a little bit more about, but we do events on campus, workshops, promotion of education through social media, collaborating with different departments such as the Student Counseling Center, University Health Services, or the Spiritual Care Center, or organizations off campus too, like Clinic, WRHA, Women's Health Clinic. And alongside my role as the educator, I also co-coordinate a program on campus called Healthy You, which Zoe briefly mentioned. So Healthy You is a peer support group led by myself and another counselor alongside our health and wellness program assistant and up to 12 student volunteers per academic year. So these students work really hard all year to get trained in various aspects of health and wellness, and then are able to run events, host workshops, and meet with students one-to-one to discuss some of those health concerns, including mental health, as well as post on social media and our blogs to help their fellow students learn more about these health and wellness topics on a regular basis. So for example, they've done events like sex pub trivia, alcohol myths, how to set boundaries in relationships, through in-person events, and through blogs on the website. So any U of Manitoba student can access Healthy You by attending events, following the social media page, coming to the drop-in hours from September to April to talk with our Healthy You volunteers. to gain some insight and coping skills to manage the stressors they might be having. So it allows students to meet with peers who are maybe going through similar challenges in relation to trying to balance that work, social, and school life. So a really great component of this role is being to access and have direct content with these mental health supports on campus. Now, given I have had some guidance in how to access these supports, I know it can be really difficult to try and navigate what is out there and what is available. So I always say, if you aren't sure where to start, or maybe if a place that you're looking for on campus, you're not sure if it's right for you, start there. They can help you sort of transition to another department or point you in the direction of a department that might be more beneficial. So someone's always going to be there to help you make sure you find the right fit. So there are multiple supports on campus, but that doesn't always make it easier to connect, which is why I love the idea of the QR code here that has been presented in this workshop. So just remember to be kind to yourself. And if you can find one number or one department to connect with, even if it maybe isn't the right fit, it is your starting point, and you can find someone who can help redirect you. So at the end of all this, I can certainly provide you with the health and wellness website, which I think someone already put the U of M Instagram in there, which is perfect. Thank you. My screen is half covering the name. Thank you, Zoe, for popping that in there. And I can answer any more questions about Healthy U or the Health and Wellness Office at the end of this if anyone has any questions. But just before we get to the question period, I wanted to take some time just to sort of discuss my interest in mental health, because I think this is a really positive platform for not so much encouraging, because everyone's already on their way to do what they want to do, but a lot of people are looking into the field of mental health, and I think that's so fantastic. So overall, I have really enjoyed taking a holistic approach to mental health. So that to be mentally well, we need to focus on our emotions and our feelings, but also our overall well-being. So our sense of our physical health, are we sleeping enough, getting enough fuel through food? Do we have a positive sense of connection in this world to support organizations or people? To be mentally well and overall have a positive sense of well-being, I think is a really important way to look at ourselves as a whole. So specific areas of mental health that I've taken interest in over the years would probably be psychosis, anxiety, and harm reduction. So I've spent a lot of my time researching cognitive behavioral therapy, which is a frontline treatment for anxiety and depression. It focuses a lot on restructuring our thoughts and how our thoughts are connected to our feelings and behaviors. I myself do struggle with a lot of anxiety, so it's been both a professional and personal journey, and I think having both sides of that really just fires my passion for CBT work. In terms of psychosis, I've done quite a bit of work with psychosis in inpatient settings, as well as the community settings, and things like Garry had mentioned too, learning about antipsychotics and different treatments for that sort of population and that sort of setting. I have found an interest too in harm reduction and really emphasizing the non-judgmental approach, and that it is really important to reduce stigma and decrease barriers sort of at a foundation to building all of these resources, because we can implement treatments and supports endlessly, but we still need to address the challenges people might have in accessing those. So that's a little bit about my experience as a psychiatric nurse. I have found that overall, it's really important to remember that we meet people where they are at. We don't make decisions for them. We don't listen to give advice, and we educate ourselves to inform, to have the information and let others do what they choose with that. So being there for someone and being a connection is so much more effective than dictating that recovery journey for them. So my words, meet people where they are at, show compassion, and understand that everyone's realities are different, even if it doesn't match your own perception. That's what someone's living with. And I think that's a really important part of mental health. And that is my blurb. Zoe, oh, thank you, Zoe. I was just about to type that in. So Zoe typed in the Healthy U of M Instagram and the Healthy U of M website, which is where a lot of our mental health content can be found, as well as other health content, but a lot of mental health blogs, tips for managing stress, anxiety, depression, relationships. It can all be found on there. And I can also write my email in here if anyone has any further questions about Healthy U, psychiatric nursing, or just mental health in general. I can try and help you out there. But if there's any questions now, I'd be also more than happy to answer any of those. I will just note, if anyone is interested in psychiatric nursing, unfortunately right now it's only offered through Brandon University, but you can also take it in Winnipeg. It's not too remote because you have in-person professors and everything, but you can also be able to take the program through Winnipeg.
All right, we have our a question, a hand up from Shelly. Shelly, you can unmute yourself.
Thank you, Brianna, for sharing your insights on mental health and your passion for it. Just with the Healthy You, you may have said this, but I may have missed it, but it's volunteer, right? Like a volunteer program for the student. So how would a student get involved?
Yeah, so if a student wants to get involved to become a volunteer, we do our volunteer applications. We promote it on sort of the Today, on different Instagram accounts, on our website. But the application process is typically in March when students can apply for the following year. So we just had our applications close as of April 1st. And then we take the applicants, we do a round of interviews, and the successful candidates would be able to move on into fall to sort of engage in all of the training, which we do once a week, and have the skills so they can meet with people one-to-one and provide that sort of education component. So if anyone is interested in becoming involved in the next term, because we are closed this term, you can feel free to reach out, and I can also send you an email closer to when applications would be open. And if someone would like to start with just accessing some of the resources or accessing Healthy You to see if it's something that would be for them, you can start with following our Instagram account, which is where we'll post all of our events that are coming up, which are free to attend. So students can attend those and see sort of what our volunteers are doing and how they're facilitating those events, and have a look if it's something that you might be interested in doing in the following year.
Yeah, thank you for that. And I'm sure you have a lot of interest in nursing students.
Nursing students, I find it's a little bit trickier for nursing students because we have quite a time commitment. It's about 3.5 to 6 hours a week, and that includes a weekly 2-hour training slot just to ensure that you have the information to be able to successfully help educate your peers. And sometimes I've found that clinicals might get in the way of that, but we have had nursing students in the past where clinicals weren't on the training days and they were able to balance the caseload and the workload, which is fantastic. We have a lot of psychology students apply as well, science students apply, all sorts of students. We can take up to 12 a year. And then it's just because we only have 2 coordinators and a health and wellness program assistant. So we just want to make sure everyone's getting the training they deserve to be in the program too.
Thank you for sharing that.
Thank you for your questions.
Brianna, I have a question. I think you mentioned you worked at some point with children and adolescents. Was that correct?
Yeah, so very casually, I worked at HSC on PY1, which is the Child and Adolescent unit, and I worked as a casual psychiatric nurse on that unit. So that was my first sort of experience into the child and adolescent world. But more intensely, I worked as a community mental health worker for children and adolescents in the Interlake. And so my role there looked like having a caseload pretty consistently of about 30 to 40 students within the surrounding area. And I would work closely with the students, with the children, with the parents, and other organizations like school guidance counselors or school teachers, whatever the child and family was open with. And we would just work on addressing mental health needs. So whether that was anxiety, depression, ADHD, behavioral challenges, a lot of social and self-esteem challenges I found with child and adolescents, and we would meet on a one-to-one basis, usually twice a week. I find overall, compared to child and adolescents and adults, child and adolescents require a little bit more frequent checking in and touching base in community. And we would go over skills, so things like cognitive behavioral therapy or dialectical behavioral therapy. And we would work on helping these students and these children get coping skills to manage their everyday life, and also work a lot with the parents and how we can reiterate that in the home life, because with skills and coping skills and any sort of self-proclaimed skills that you're trying to learn for your mental health challenges, a lot of it is not necessarily homework, but repetition and practicing and repeating, trying to create that routine. So a lot of it was working with the child, and then the school guidance counselors and the family to help create that routine environment where the student can continually try to access that. And then I worked a little bit with psychiatrists as well alongside of that for children that were maybe going to start on an antidepressant medication or an ADHD type medication, and going through a consult just to see if that was the right fit for them.
Thanks for explaining that.
Yeah, thank you.
Yeah.
I don't think I see any other questions, but if there are any questions, feel free later on that come up about psychiatric nursing or the role here, the Healthy You program. Absolutely, anyone can email me at any time, and I'd be happy to chat about that.
Thank you again so much, Brianna. And again, I will just reiterate what Brianna had said. Any other questions or anything that does pop up that you are curious about, you have all of the resources there in the chat. Please feel free to reach out to the email or to adding on social media. I would now like to call upon Shelly Marchenko, faculty member of the College of Nursing, for final remarks about connecting one conversation at a time.
So we did a student survey attached to this project. So this was about June last year, where we sent, well, this was actually to find a name for the project. So we sent out a survey link to students, asking them about the name, but what other activities they would like to see attached to the project. And we actually got about 90 responses, which was quite remarkable. But these were just some of the highlights of what students thought they would like. Around social media, so interactive posts, stories and podcasts from people with lived experience. That seemed to be a really one that was mentioned often. Stories from healthcare providers on how they address mental health in their practice. So, just even hearing, for example, from Brianna today about her mental health, being a mental health nurse and her experiences. Instagram takeovers. So a lot around social media, which Zoe has been, and Jillian have been working on, and have done a lot of great things with the Instagram. Activities and events. So some of them were like games, trivia, quizzes, prizes, in-person activities, especially with the COVID. And last year when we did this survey, the COVID was still going on. So arts, craft, even somebody mentioned bowling. Events, get to know me mix, or some students said they were more shy, and events would be great. Activities for self-care. Events are ways to advocate for mental health. And one student wrote that, students want a safe place to talk with other students about mental health, which is really the purpose of the project. This is the link to the Instagram. Louisa mentioned apps, and this is a couple of the apps that we have on the link tree. So the Wellness Together Canada is one that I got an email from the Mental Health Commission of Canada informing me about this app. So I shared the link with Zoe, and there's a number of different resources on here, from mental health to addiction, information about self-care, managing worry. So this is one of them, and then the other one, the other one is Anxiety Canada. So the Mind Shift app, and it's got a lot of CBT tools on here. Brianna was talking about different CBT tool, cognitive-based strategies. Again, just ways to de-stress, cope with anxiety, and it's got some information around mindfulness, goal setting. So a couple of the apps here. So these are just the primary resources or main resources. If somebody is experiencing a mental health emergency or crisis, or is experiencing a lot of emotional distress, so there's clinic, and then the Student Counseling Center, University Health Services, and then another more prominent resource would be the Health and Wellness Office at for 69 Sioux. And these can be accessed through the link tree. So just a final, our goals, objectives for the project is to provide a welcoming space that encourages peer-to-peer conversations about mental health, to inform the university community about mental health resources, and through education and events to emphasize the significance of mental health in our daily lives. So our future events that we're thinking about are September, so hopefully in person. Welcome back. Sometime in December around either around winter break time, maybe earlier in November, or just in December right after exams, and then the January wrap up. So thank you very much to our audience and our speakers.
Thank you so much, Shelly, and thank you everyone who participated today. This is the conclusion of our event. Thank you, Tyla Turman, for inviting us to participate in the Nursing Week celebrations. And thank you all again for joining us today.